Ruth Werner's best-selling book, A Massage Therapist's Guide to Pathology, is a highly regarded, comprehensive resource that sets the standard for pathology education. Written for massage therapy students and practitioners, this groundbreaking resource serves up a comprehensive review of the pathophysiology, signs, symptoms, and treatment of more than 500 diseases and disorders. Learn more at booksofdiscovery.com.
Anatomy Trains is happy to announce our return to the dissection lab in person, January 10th to the 14th, 2022, at the Laboratory of Anatomical Enlightenment in Boulder, Colorado. We are thrilled to be back in the lab with Anatomy Trains author Tom Myers and master dissector Todd Garcia. Join students from around the world and from all types of manual, movement, and fitness professions to explore the real human form, not the images you get from books. This is an exclusive invitation. Email info@anatomytrains.com if you'd like to join us in the lab.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Today, we have a twofer. I got a great story very recently, but it also connected to a question that's been in my keeper file for a while. So we're going to do them both. We will start with a story from a massage therapist whose client had a surprise diagnosis, not a great one. And the advice she says she got from her doctor about massage was also surprising and maybe also not great. I want to offer my special thanks to the massage therapist who generously shared this and to the multitudes of people who responded to this post with some very good advice indeed. And the story goes like this. I have a client that I've been seeing bi-weekly for a year or more, and a couple of months ago, I found a lump in her arm, and she went to see her doctor. Turns out it was a swollen lymph node, and since then, she has them throughout her entire body. She's scheduled for a PET scan and a bone marrow biopsy. She's been diagnosed with T-cell lymphoma. My question is it safe to continue massages with this client? She told me that her doctor said that it's perfectly safe, but I just really want to be safe for her and for myself. Wow, wow, wow. I am really glad that this therapist is concerned about safety. On the surface, this situation looks like a no-brainer. We've got enlarged lymph nodes throughout the body. We have a diagnosis of T-cell lymphoma and more tests to come. Obviously, this is a hands-off situation. But hang on just for a moment. This massage therapist and the client have been working together for twice a month for a really long time. It was the massage therapist's finding of the lump that led to this important diagnosis. The massage therapist found this tissue anomaly. The client followed up with her doctor. That sounds like a great situation and a really functional relationship. So should we just put the brakes on this altogether? Is that really in the client's best interest? Well, we will return to that question in a bit. But first, let's look at T-cell lymphoma. Lymphomas are classified as Hodgkin lymphoma and non-Hodgkin lymphoma, and these are all cancers that affect B cells and T cells and natural killer cells. They begin in lymphatic tissue where these mutated cells replicate, so we are producing massive numbers of non-functioning lymphocytes. And all the lymphatic tissues may become enlarged. So symptoms come up like anemia because all the red blood cells are being crowded out of the bloodstream, but also things like night sweats and itchy skin and fatigue. Some types of lymphoma form tumors, and these often begin in the lymph nodes and spread to other lymph nodes, or they might affect the bones, which is why the client in this story needs a bone marrow biopsy. And these tumors may also develop in the spleen, or the liver, or even in the central nervous system. Lymphoma is staged by how many nodal regions are affected and how well differentiated the cells are, and by their behavior. And I want to look at that variable just for a moment. Low-grade lymphoma grows slowly, which we like, but it is also resistant to treatment, which we don't like. And it can change to become aggressive later, which we really don't like. Intermediate grade lymphoma is aggressive, but it also responds well to treatment. It's our favorite kind of lymphoma because it generally has a good prognosis. High-grade lymphoma is aggressive, it moves fast, it spreads rapidly, and sometimes it is responsive to treatment, but other times it is resistant. There are several different types of T-cell lymphoma, and there's some overlap between some of these types of cancer and some types of leukemia, another sort of blood cancer. And the line between what is lymphoma and what is leukemia is not so distinct as we once thought. That's an issue probably more important to oncologists than to massage therapists, so I guess we can leave it alone. I was not able to find out the results of the client's tests or to see what type of T-cell lymphoma we're talking about, so we won't be able to get super specific with the rest of this discussion. As I learned about each subtype, I looked for clues that might have been represented in the description that we've had about this client, but there were no clear winners. Some types of T-cell lymphoma, however, affect the skin, and nothing in today's contributor's description suggests that that's what we're seeing with this client. However, this does tie into an I have a client who question that I got months ago and I never answered about two versions of cutaneous T-cell lymphoma. And here is that I have a client who question. Has anyone worked on a client with Sézary syndrome, and open parenthesis, mycosis fungoides, close parenthesis? If so, what techniques, precautions, lubricants, etc. did you use? Greatly appreciate the input. Well, depending on who you read, mycosis fungoides and Sézary syndrome are two different types of cutaneous T-cell lymphomas, but they're often confused with each other. Or mycosis fungoides can eventually turn into Sézary syndrome, maybe. They both involve scaly, red lesions on the skin. Mycosis fungoides tends to be patchy, and the skin can become hardened into plaques, and these plaques can become infected, and it can be quite serious. But Sézary syndrome is more spread out all over the body, and cells from these growths can invade lymph nodes and organs. Sézary syndrome is generally considered to be more serious than mycosis fungoides. So treatment for T-cell lymphoma in general obviously is going to depend on the kind, the stage, the characteristics of the mutations, and treatments can include any combination of chemotherapy and radiation and immunotherapy and stem cell transplantation and surgery. We sort of pull out all the stops for this situation. Sometimes those cutaneous T-cell lymphomas can be slow growing, and they can respond to less invasive options like some topical medications or UV light therapy. There's a thing called electric beam therapy that works for some people. And there's another intervention, and I just had to share the name with you. It's called extracorporeal photopheresis. In extracorporeal photopheresis, blood is removed from the patient. It's treated with drugs that become active when exposed to ultraviolet light, and then they shine UV light on it. and then the treated blood is put back into the patient's body. Extracorporeal photopheresis. Now, all of these treatments, they sound pretty intense and challenging, and they have significant implications for massage therapy, especially things having to do with the skin. So let's bring this discussion back to think about decisions for our contributors. We have two clients here. We have one client with some undetermined type of T-cell lymphoma that has led to multiple swollen or enlarged lymph nodes all over her body, and we don't know what other repercussions related to this disease. And we have another client who has either or both Mycosis fungoides or Sézary syndrome. And for both of these clients, their massage therapists are hoping to be able to continue to work. Our initial contributor says, "My client told me her doctor said that massage is perfectly safe." Eek. That worries me. First of all, we don't know what kind of cancer this client is dealing with. We don't know what her prognosis is. We don't know what stage she's at, and we don't know what kind of treatment she will need. All of these variables have to be identified before we have enough information to safely move forward. And even then, and even if it's the best possible scenario and the cancer has not invaded organs or bone marrow, and the cancer is super responsive to treatment, and the client doesn't have a slew of terrible side effects, I'm still not sure it's, quote, perfectly safe to receive massage under all this challenge. This client is going to be going through a lot of stress as she goes through this process. Super gentle massage that is designed to be supportive and relaxing rather than challenging or energizing might be helpful if it is incorporated appropriately into the rest of her care. So I have two really strong recommendations for this massage therapist. Number one, get some advanced education in oncology massage therapy. There's a lot to choose from. I will put some of my favorites in the show notes. And two, with permission, consult with your client's healthcare team. Describe your work. Describe your hoped-for outcomes. And make sure what you're working toward is in alignment with the rest of the treatments that your client has to get through. For our other contributor, well, let's think for a minute. This client, remember, has either mycosis fungoides or a Sézary syndrome or both of which these are cutaneous forms of a potentially aggressive form of cancer. And even though the rules about massage and cancer have changed since I got into this profession, because I'm of the generation who were taught that massage and cancer don't go in the same sentence, I think we can all agree that we don't rub on cancerous growths, right? And mycosis fungoides and Sézary syndrome, these involve cancerous growths right there on the surface of the skin, with a risk for infection and metastasis to the internal organs. So I'm going to say that asking for advice about massage techniques and what kinds of lubricants to use, this is not the right direction to take until or unless these more important risks are addressed. If the client is in treatment, if their cancer is slow growing, if their skin is intact and not at risk for infection, if they're physically active and resilient enough to adapt to the challenges of massage therapy, then maybe gentle work is safe and appropriate. But, and I hope you know what I'm going to say next, at the risk of sounding like a broken record, get advanced education in oncology massage and consult with the healthcare team. Make sure your goals and your client's goals and the oncologist's goals are all in alignment. I have not made a habit of including stories about massage for people with cancer in I Have a Client Who before. Mainly, it's because our profession is richly blessed with many people who have dedicated their whole professional lives to learning and teaching about massage therapy in the context of cancer. So I am perfectly happy to refer questioners to people who have much more expertise than I do. But keep sending me your stories. If they are about clients who have cancer, here's what I will do. I will provide you with some technical information about whatever kind of cancer it is that we're talking about. But when it comes to making clinical decisions, we will go back to basics. Get more education about oncology massage therapy. Work with the rest of the client's healthcare team. It is well demonstrated that massage therapy has great things to bring to clients undergoing treatment for cancer, but only when we can bring it with the right kind of training and education and the right kind of coordination with other people who are working for the same outcomes. Hey, everybody. Thanks for listening to I Have a Client Who Pathology Conversations with Ruth Werner. Remember, you can send me your I Have a Client Who stories to ihaveaclientwho@abmp.com. That's I Have a Client Who, all one word, all lowercase, at abmp.com. I can't wait to see what you send me, and I'll see you next time.